tooth is not a brick or a block. It is having anatomy and it's having topography. And one of the topographies in any tooth is having, especially the back tooth, the back teeth, is having pits and fissures. And the sticky and sugary food will stick into these pits and fissures, causing dental caries. By the way, the pits and fissures are the first place where the caries initiate. Usually they don't start on smooth surface, but they start usually in pits and fissures where it's difficult to rinse or even to clean with normal means or using toothpaste and toothbrush. Another reason why should dental caries happen to our children is fizzy drinks. And when we say fizzy drinks, we consider the amount of sugar which is incorporated in making the fizzy drinks, as almost half of the content of whatever we drink out of the fizzy drinks is containing sugar. And sugar is the simplest form of carbohydrates. Carbohydrates, generally speaking, they are either starch, either fibers, or simple sugars like glucose and fructose. And the idea of fizzy drinks having will nourish the cariogenic bacteria to initiate, to multiply, and to start being dominant in the mouth and start digging into our teeth and our children's teeth. Also, something which is just its equivalent to the fizzy drinks is what's known and what's known in our society, which is the karakti. Karakti is recently, in the past maybe 5 to 10 years, our community started to being indulged very much with this type of drink, and this kind of drink is also full of sugar. And as the maker of this karak is basically just they are just boiling karak, and then until it becomes highly thick and bitter, and then they break this bitterness using milk and as well as using high amounts of sugar. So also karak is full of sugar and highly cariogenic. Also, we can consider also frequent snacking is a major cariogenic effect, as if we stick ourselves to 3 meals, which is breakfast, lunch, and dinner, maybe the cariogenic bacteria will not have that much nourishment. However, if we, in between breakfast and lunch and between lunch and dinner, we keep on just keeping our mouth busy with something or some bakery or some sweet chocolate or even drink, then that's the time we will provide for the cariogenic bacteria a reason why should they multiply and cause for our children decay. Also, last but not least, is less water drinking. As we know that we do have in our mouth saliva. Saliva main function is to wash off whatever may stick on our teeth and whatever stick on in our mouth from whatever we eat or whatever we drink. So the idea of just being dependent on just saliva to wash off our teeth cannot be tolerated. Why? Because the saliva production is not that high, and it's about 5 to 10 ml per 15 minutes, which is considerably very low to wash off whatever we eat or drink. And on top of that, especially if we are frequent snackers, So less water can also fast provide nourishment for dental caries. But how can we identify dental caries? How can we identify dental caries? How do we know, as parents, how can we know that our child is having dental caries? Because we want it before they start having pain and rushing to the dentist. First of all, you see your kid having uh, sensitivity, sensitivity in one particular tooth or particular group of teeth in one area. Initially, maybe it was normal, but later on it's becoming more and more sensitive. Why? Because the sensitive part of the tooth is being exposed. Another also identification point is food entrapment. Food entrapment means that there's already cavitation, there's already hole started within the tooth, and that's why food started filling this cavity, and it's difficult to clean it or brush it. And that's why it will give us the third identification, which is bad breath, because the food which is sticking in the hole or the cavity will be fermented and causing bad breath. Also, the last stage of identification is having toothache. Initially, maybe while eating on that side, but later on it will be spontaneous type of pain. And if we just keep it without attendance, then that's the time it will be exponentiating type of pain. But what are the advices for parents in order to avoid or actually mitigate the idea of having dental caries in our kids? First of all, is keeping away from the 6 risk factors, which I mentioned earlier: sticky food, frequent snacking, sweet drinks, not brushing teeth. All this, if we avoid, we are trying to reduce the risk of having dental caries and exposing ourselves and our kids to unpleasant experiences. Then secondly, we have to encourage our children to brush twice daily with suitable toothpaste and suitable toothbrush. And here, the idea of having brushing with a suitable toothpaste and suitable toothbrush, just this requires another maybe presentation on its own. It requires like maybe more than an hour to explain. However, I can just condense it into 2 words. Just select appropriate toothpaste, which is coinciding with the age of the child. For example, my child is 5 or 6 years old, so we select a toothpaste which is suitable for this age group. Another also method and way to reduce and mitigate dental caries is using dental floss. And maybe to most of us, maybe the idea of flossing teeth is like is not a pleasant practice, and it has no meaning. However, what I can tell you is that the toothpaste and toothbrush are not enough to clean all the tooth surface. And why? Because the tooth surface is not having 2 surfaces, outside and inside, though we think that it is only the outside and inside. The toothpaste, the tooth itself or the teeth, they're having more than 2 surfaces, which is, I can discount them as 5 surfaces: the outermost surface, the innermost surface, the front surface, the back surface, as well as the top surface. And let's just imagine that the tooth is like a cube. The cube is having 5 surfaces: the upper, front, back, out, and in. So we have to clean even in between the teeth. Why? Because food may stick in between the teeth, and especially in growing child. Why again? Because also the jaw of the child is growing, and the intensity of the of teeth together is being lost slowly. Why? Because the milk teeth are baby's teeth and child's tooth, while at the same time the jaw is growing, which makes the teeth decimated, and the food may stick in between, causing dental caries. Also, I have to consider and not forget that healthy diet is an important factor of having good health, good growing, healthy growing, and as well as good teeth. You have to consider this healthy diet and not considering just junk food or just being dependent on just snacking. We have to have proper meals, a proper breakfast, portion of lunch, portion of dinner, and it has to be healthy, which means that it has to contain healthy vitamins and healthy diet. Also, I have to mention that water rinse is important in order for the child, in order to help the saliva to wash off whatever our child just eats or drinks. If the idea of not having water is should not be tolerated, because at the end the mouth will be dependent on saliva, and which I mentioned earlier that the amount of saliva is very small in order to wash the whatever food or drink we have. So we have to help that with using water rinse. Also, we should not forget, last and not least, visiting a dentist regularly as per the recommendation. And here, as per recommendation, different dentists will consider different visiting intervals for different children, as different dentists will, as soon as they receive the child, they categorize the child according to the number of decays and the frequency of cavities. Either they consider them as of high risk or moderate risk or low risk category, and accordingly they'll provide them with the care by providing dental visits every now and then accordingly. Okay, otherwise, if we don't stick to the dentist's recommendation, then that's the time we lose the track, and we expose our child to unnecessary, unpleasant feelings. Here also, I have to mention something about dentists and the idea of having one particular dentist and not entertain the idea of just hopping across the market from one dentist to another, because the idea of jumping from one dentist to another, maybe you may be happy with having whatever service you are going to give to your child, but the follow-up is very important, and there will not be dentists who are going to prevent whatever is happening to our child. And this is what we call as dental home. So dental home is necessary and mandatory, not even for children, but also for adults. Having particular dentists which we follow up may shortcut so much for us, rather than just hopping across the market and jumping from one dentist to another. And this is the last slide, the signs of healthy and beautiful smile. If we see our child will be having clean teeth with no food debris, that's great. That's a good sign of having beautiful and healthy smile. Another sign is having fresh breath, no bad breath, no smelly mouth, no bad odor. Okay, and the third healthy sign is no bleeding, even